Hi YouTube, I am doing another video. I'm sorry it took so long, but as I always say, I be busy and stuff, and the lighting in my new apartment is not all that great, so I have to work on my lighting and my video shooting. So you'll see a video here and there until I work on that. Then I'll be making some more. But what I wanted to speak to you about today, I went to the doctor, my hematologist, and I usually go just to get checked. They told me my hemoglobin was 5.7. Now, what some doctors is not going to tell you is after you have a child, well, during that childbearing period, far as a female, you're going to lose blood. You're going to lose hemoglobin. And the further you go into your pregnancy, sometimes the lower your blood count gets. With my first pregnancy, when I was 19, I started off as 7.2. I was 19, so I started off as 7.2, and by the time I got to the third or fourth month, before the miscarriage, it was basically 6.9. And once I had the miscarriage, it stayed like that. So I noticed after I had my son this time, at the age of 34, during the time of my childbearing him, it got low. It got low to the point of 5.7. And I was hoping that wasn't going to be my actual hemoglobin after he was born, but it was. So they're trying to they want that higher. Now, the thing with this is that, okay, you want it higher, that's fine. But at a certain point, your body gets used to that certain hemoglobin that it stays at. And you're not symptomatic to it anymore. But and I live a healthy life with it. I really do. The only time it affects me is on my menstrual cycle. And what I do for that is basically stay clear of exhausting myself. Keep a few leaves, Advils around. Kind of like take it easy. And drink a lot of water. I drink wheatgrass because that helps with your fetal hemoglobin. So anything that helps with your fetal hemoglobin is sort of help with your surface hemoglobin. That's what I call it. So it may not show that it's helping your hemoglobin in general, but you're going to feel great. You're going to feel much better as your fetal hemoglobin kind of like restores itself with the wheatgrass and you taking it easy and stuff. You go to get a few aches and pains. Well, far as my condition, myself. I get a few aches and pains still. When it rains like today, I have to be very much, careful of exhausting myself. But what I really wanted to talk about was that when I went to the doctor and they saw my hemoglobin was so low, they referred to me Hydroxyurea. Now, this medication may have helped people, I'm not doing to down it, but it may have helped. But you have to consider the long-term effects. This medication is basically a chemotherapy for cancer patients, and they use it for sickle cell patients. So, because it has an effect of bringing your hemoglobin up, with still high risks involved. But as I heard, it's supposed to help. So a lot of people it didn't agree with. Some people still take it. Some people, agree with it. Me, myself, I try not to put toxins in my body. So, they wanted me to watch this video. I don't know if y'all ever received something like this, but it says Hydroxyurea, the best option for sickle cell anemia. And I got this at Beth Israel Hospital, the hematology department. It's kind of strange how they're advertising this medication to be so well equipped for sickle cell, but when you do the serious research, this medication then cause leukemia, tumors, and other sorts of cancerous effects. So, and they will not tell you this. They will not tell you this at all. They will not tell you this at all. And I want y'all to excuse me. I'm in my bathroom because this is the best lighting. This is the best lighting. So I'm in my bathroom. But yeah, this is crazy. I never looked at the video. It's been some months now. But I wanted to show y'all the way that they're, advertising this medication. One is through a DVD. So if y'all get this DVD and y'all pop it in the DVD player and it shows all this beautiful stuff, which I might look at it just to see what they're talking about. But I will never try this medication. They will tell you that there has been no findings that this medication caused cancer. But if you do the severe research, the serious research, you will find that in different locations, different areas of different states and countries and stuff, this medication has been not good for people. I would want to know. I would want to know why somebody would get this medication prescribed, then look at the side effects and be like, okay, let me pop one in my mouth now. I just don't see the logic to this. But people do it. But I'm here to warn you. This medication is not well. This medication is not good. And this is only part 1, because part 2 of the next video, I'm going to show you the findings that when I researched, I'm going to show you the findings. Give me some time. Oh, goodness. Give me some time and I will definitely have that for you. But I have definitely looked into holistic remedies. And far as my sickle cell goes and my hemoglobin, I've been great. Your body have a certain way of adapting, and it has a certain way of restoring itself. Which science, healthcare can't understand that. They feel as though you need this and you need that and we have to this and we have to that so you can get better. No, it's not true. The more you take care of yourself with what God is allowing you to live with, you will be fine. You will be fine. But there's a lot of people that don't want to take that risk. They take all these medications, they take all this pain medications, and they ruin themselves. This medication is liable to start you having kidney problems. Now, once you get into kidney problems, what's next? Dialysis. And once you get onto dialysis, that's pretty much, they're profiting, them profiting off of you, and your health going down the drain. So you really want to try to stay away from sodas, try to stay away from concentrated juices. The best thing to drink is water. Best thing to drink is wheatgrass, cod liver oil. Cod liver oil, I promote that so much due to the fact that it helps the inflammation that the sickle cell creates. And once you have inflammation, you will soon have a crisis. So inflammation flares up a crisis due to the lack of something you're not doing within your body. But it causes inflammation, and inflammation causes a crisis. But what helps inflammation to seize itself is omega-3 acids. Where does omega-3 acids come from? Fish, cod liver oils, omega-3, not omega-6. Omega-6 create inflammation. You don't want to intake those type of oils. You want to intake omega-3. Omega-6 create inflammation. Omega-3 ends inflammation. So try to remember that. But also, just take care of yourself. The wheatgrass helps the fetal hemoglobin. Vitamin C, I also take that. That helps to keep you well from infections, colds. We're bound to get sick all the time. But once you start taking care of yourself, you will see that you will barely get a cold. You will barely get a infection. I haven't had a cold probably almost a year almost a year. Yeah, I would say almost a year. So take care of yourself. Really take care of yourself and watch what these doctors is telling you, because they're not only there to so-called help you, they're there to make a profit also. So with making a profit, it's keeping you, let's see, maybe 50 to 70% well, while the other part of that percentage, they go to try to keep you not well so you could keep coming back. If you have any questions for me, if you have any concerns with your own well-being with sickle cell, please contact me. Leave me a message. Anything. And I'll answer you back. My email address is for right now is allenteresa80@gmail.com. So I hope you like this video. I hope it was a help. And please thumbs it up, subscribe. I don't not really trying to get paid for this. I really just want to get information out there that a lot of people with sickle cell do not know. A lot of people, families with sickle cell, do not know about. So that's why I said, please leave me questions. Give me questions. Give me questions. And I will definitely make sure I answer them. Also, I guess that's it. You have a blessed day. And like I said, I hope this video helped you. So, God bless and see you later.